It's a Tuesday morning, and we want to talk about heart disease. I have a special guest this morning with heart disease remaining the leading cause of death in the U.S., affecting millions of people over the age of 55. But right now, groundbreaking research could change how millions of Americans approach heart disease prevention. So joining us this morning is Dr. Matthew Budoff, a cardiologist and professor of medicine at David Geffen School of Medicine at UCLA. Thanks for joining me this morning, Doctor. How are you?
I'm doing great. Thanks for having me on.
Yeah, absolutely. We want to just start with basics, Doctor. When most people think about heart disease prevention, we think about diet, exercise, maybe a little cholesterol medication. But your research is focusing on reducing inflammation. How does that go?
Yeah, so, over the last decade, we learned that inflammation, of course, is bad. When you have arthritis, you get inflammation. You can get inflammation in different body parts. But when it gets into the coronary arteries, it can cause heart attacks and strokes, and it can promote plaque buildup. So we've been studying this and now learning that by treating the inflammation in the arteries of the heart can actually help reduce your cardiac risk.
I mean, it sounds so promising, Doctor. So, for those who might be hearing this for the first time, what is happening then with our arteries inside when inflammation does present itself?
Yeah, so we have this plaque buildup, and that might be from genetics, from mom or dad having heart disease, or it might be from blood pressure or cholesterol or diabetes. But once you have plaque building up in the arteries, inflammation can kind of feed that process and make it worse. So we want to understand if you have that inflammation, and then we can potentially use very simple once-a-day medicines to help reduce your risk of heart disease by treating the inflammation.
So, how do you know if inflammation, if inflammation is one of those major causes for some of your health ailments?
Yeah, so you really have to get a blood test. It's very simple. It can be done at the same time that you go for your cholesterol check or your blood pressure medicine check or your hemoglobin A1C if you're checking your diabetes. They can add this blood test to the panel and find out if you have inflammation.
And if you're talking about medication, if people are already taking a statin or some cholesterol lowering medication, how does inflammation fit into that place? And what's your research finding now with this medication that could lower inflammation?
Yeah, so we think one of the benefits of statins is that it also not only lowers cholesterol, but it helps with inflammation. But this additional therapy, what we studied, colchicine, just 0.5 milligrams low dose at once a day, can help further reduce inflammation in the arteries around the heart and reduce the plaque buildup over time so that you're not heading down that road of heart attack or stroke or bypass surgery.
It almost sounds too good to be true. How does one go? I've never even heard of colchicine, but what is this exactly, and what can patients do to try to advocate for themselves?
Yeah, colchicine is actually a very old therapy. It's been around for a long time. We use it to treat gout, one of the arthritis that can affect the toes, and sometimes that can be quite severe. And colchicine has been used for decades to treat gout. Now we learned at a much lower dose, which it's safer and better tolerated, it can also help treat the inflammation around the arteries in the heart. So that's really where we're focusing our attention now, is to try to reduce that inflammation in the heart and really hopefully improve people's long-term heart health.
And this can work alongside a statin or cholesterol-lowering medication, right? What should people be aware of as far as other side effects if they're looking to research this seriously?
Yeah, I mean, the only side effect that we see, and it's usually very mild, is diarrhea. But because this is such a low dose, that's fairly infrequent. So just keep in mind, if you look up colchicine, to look up low dose colchicine. This is 0.5 milligrams once a day. For gout, we use more than double that. So there's more side effects when we use it at higher doses for gout.
Okay, very good. And who is the ideal candidate then for this?
So I think, people who have early heart disease, people who have plaque building up in their arteries, maybe they got a heart scan, or they were told by their doctor that they're at high risk of heart disease. This might be a good opportunity to look for inflammation. And if it's present, to then think about treatment and talk to your doctor about this as another treatment option for yourself.
And beyond medication, what do people need to start thinking about in their daily lives in conjunction with all of the health awareness that we need to have?
Yeah, I mean, and I think, you mentioned at the beginning, but we have, diet is important. We got to keep an eye on our weight, and we got to keep an eye on our, eating better foods in general, like maybe the Mediterranean diet, or there's different diets that might be helpful for your heart. And then we also want to remember exercise is a key component here, that we really want to make sure that we're getting in our steps, or doing something that's more active. It's good for the heart, because the heart's a muscle. It likes to exercise, it gets stronger, but it's good for the brain, it's good for the joints. So exercise is critical.
All right. What's good for the body is good for the mind and everything else. What's next in this field as far as the future, and what other questions do you need to look into?
Yeah, so we're doing more trials. They're ongoing already. Our trial, what we call the Ekstrom trial, looked at plaque progression, and we showed that low-dose colchicine slows down the progression of plaque in the arteries. Now we're looking at more larger studies to look at heart attack risk reduction, at reducing strokes, at reducing cardiac death. So there's more data coming out, and there's a lot of studies that have been done, and a lot more that are being done.
All right, very good, doctor. And anything else that we haven't covered that our viewers and listeners should know about?
Well, no, I would just say that if they want to learn more about the art trial, or about the inflammation and how they can learn more about it, there is a website, cvdinflammation.com. So all one word, cvdinflammation.com, and I think that'll help give them a little more information to maybe bring back to their doctor and talk to them about other opportunities for good heart health. Just keep in mind, for men and women, the number one cause of death in the United States is still heart disease. So we gotta keep this on the top of mind when we talk about cardiac risk factors.
Absolutely. All right. Well, thank you so much for sharing your time with us this morning. Important information for people, just overall health. I mean, in 55 should be is the new 35.
Right. That's right. And 70 is the new 55.
There we go. Let's keep it going. All right. Colchicine. We're going to be hearing a little bit more about that. Dr. Matthew Budoff from UCLA. Good information there. As we